CPAP has been found to lower the chances of critically ill patients from being intubated and can greatly help the suffering respiratory failure patient. Let's talk about how we can use this great tool to help our patients. Hey everyone, I'm Steve, Paramedic Instructor Coordinator. CPAP, or Continuous Airway Positive Pressure, is a great tool that is being brought into the EMT scope of practice. We can think of CPAP as being a cross between a non-rebreather and a BVM. This is because it produces two things. One, increased oxygen like our non-rebreather, and two, increased pressure like our BVM. In fact, if we think about delivering oxygen to our patients in a stepwise fashion, starting with nasal cannula at the bottom, moving to non-rebreather, and then eventually BVM, we can stick CPAP right in between the non-rebreather and the BVM. It's great for those patients that need a little bit more oxygen than the non-rebreather, but they're still conscious and able to breathe on their own, and so they're not needing to be ventilated. Again, CPAP delivers two things: oxygen and pressure. CPAP delivers a 100% oxygen with a tightly fitting mask that makes a very good seal. This greatly increases the amount of oxygen delivered to our patients, or FiO2, fraction of inspired oxygen, and is what's needed in patients with low SpO2 levels. CPAP also delivers positive pressure upon inhalation and continues that pressure during exhalation. The pressure delivered by CPAP is called PEEP, or positive expiratory end pressure. PEEP keeps pressure remaining in the airways during the exhalation cycle. Simply put, PEEP opens and stents the alveoli, creating more surface area for gas exchange to occur and oxygen to get into the bloodstream. So why do we want this? Damaged or diseased alveoli can collapse and stick together. Constant opening and closing of the alveoli can cause significant damage. Even more so, opening alveoli and keeping them open, the recruit and stent, allows for better ventilation and perfusion in those areas. You can actually create PEEP yourself by breathing through pursed lips. You often see this in patients with emphysema. So who are we going to treat with CPAP? Well, these are going to be our severe respiratory distress and respiratory failure patients. The patients that fit in this category are of two types. First type are patients that are oxygen dependent. These are patients that are hypoxemic and are failing to oxygenate. Examples of these patients are dense pneumonia and CHF. The treatment for these patients is increasing that oxygen, or FiO2. We also want to increase airway pressure as well. This is your CPAP patient. CPAP will stent and recruit the alveoli and keep them open from breath to breath. It will also provide extra oxygen to help bring up that SpO2 level. The second type of patient are CO2 dependent. These patients are having some sort of physical restriction or bronchospasm that is causing them to have CO2 retention. They cannot get rid of their CO2. They are hypercarbic and are having failure to ventilate. An example of this would be COPD and asthma patients. The treatment for these patients is increasing the respiratory rate and tidal volume. When setting the PEEP for our CPAP, start as low as possible and titrate to effect. If you get up to 10 of PEEP and the patient still needs more, hold up and readjust your strategy. Never go past a PEEP of 20. This is because it can surpass the esophageal sphincter and cause vomiting. Let's talk about setting up our CPAP. Opening up the package, you will find the CPAP tubing and the mask with head straps. Starting at the end of the tubing and working our way to the mask, we'll begin with the green adapter that attaches to the high flow regulator on the oxygen tank. This can be used for portable and onboard oxygen in the ambulance. The CPAP has tubing that can expand to reach your patient. And following the tubing, we end up at the PEEP valve, which can be adjusted by screwing the top and has a selection of 5, 7.5, and 10 of PEEP for this model. We then connect the PEEP valve to the CPAP mask. Before placing the mask on the patient, I like to first set my straps, making them slightly loose so that I can easily apply it onto the patient. I then like to grab the mask in a CE type hold and take the head straps and place them over the front of the mask. This will help when applying to the patient, as then I can easily put them up over the patient's head. To place the mask on the patient, first make sure the oxygen is flowing. Then bring the mask up to the patient's face, placing the chin inside the facepiece and placing the mask onto the patient. Put the head straps up over the top of the patient's head and connect the sides. Adjust the forehead stirrup and straps to make a nice snug fit. Lastly, check for any leaks and adjust your PEEP valve. Then reassess your patient. COPD and asthma patients have a physical restriction from swelling. These patients are unable to get ventilations out, so they are hypercarbic. They need to open up their airways and offload the CO2. Adding inline nebulizers will help open the patient's airways and allowing this patient to breathe better. Adding small volume nebulizers to our CPAP will help open up our patient's airways, allowing them to better exhale. To attach a small volume nebulizer to the CPAP, take the medication cup from a nebulizer set and attach it to the adapter on the bottom of the PEEP valve. The adapter has a one-way valve, so you don't need to be concerned about any air being lost. Set the oxygen for the nebulizer between 6 and 8 liters per minute. Along with adding small volume nebulizers to our CPAP for our COPD and asthma patients, we also need to discuss what our PEEP setting is going to be. For these patients, we need as low as PEEP as possible, no more than 5. This makes sense because our patients are having difficulty exhaling, and we don't want to add to that difficulty. Contraindications of CPAP are going to include altered mental status. Patients need to be able to maintain their own airway. They also need to have the ability to communicate. Vomiting, or recently were vomiting, excessive secretions, history of obstructions, example tongue cancer, and also providers need to be cautious about increased pressure in the chest. This can cause the heart to not pump effectively with high PEEP, especially in patients with low blood pressure. Watch out for hypotension. Let's talk about assisting with the application of the CPAP. Many patients often don't like the feeling of a CPAP. This is because it's large, loud, and claustrophobic. Patients also describe the continuous pressure as a feeling as if they are trying to breathe underwater. A few tips to help a patient feel more comfortable with the CPAP is we can allow them to self-apply the mask. This gives them the ability to pull back if they need to. We can also start on the lowest PEEP setting and titrate up to effect, allowing them time to get comfortable. Once the patient is comfortable with the device, we can then slip the straps on their head to get that nice tight seal. CPAP is an amazing tool, and I'm so happy that it's finally been brought down to the EMT level. Thanks for joining me, and if you have any questions, please reach out.